Good morning, and thank you for attending. Today, I'm joined by Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, to give an update on our local COVID-19 situation, and Andrew McClellan, Director of COVID-19 Immunization Strategy, will provide an update on the vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the Health Unit resides on land covered by the Robinson and Huron Treaty of 1850. This land is a traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. I encourage everyone to continue on your journey of learning as we work to contribute to the process of reconciliation. Since the start of November, we've declared 2 COVID-19 outbreaks. Currently, Barclay House has 7 active cases with 36 resolved. The outbreak at Au Chateau has remained at 2 individuals. As discussed last week, due to our ministry reporting requirements, we must report any COVID-19 case that is admitted to hospital as a hospitalization, regardless of their admission diagnosis. Due to privacy considerations, we do not release case-level data, including data related to admission diagnosis of individuals in hospital. Therefore, not all hospitalizations in cases reported by the Health Unit are necessarily COVID-19 related. At this time, I'm pleased to say that no one who tested positive for COVID-19 in either outbreak have had severe illness, and we have had no deaths. Although the outbreaks are not yet over, I believe that we would be in a completely different situation should these outbreaks have taken place just a year ago, before COVID-19 vaccines were available. No vaccine is 100% effective, but we have seen how the vaccine can help prevent serious illness and lessen the burden on our healthcare system. We know that some vulnerable populations are experiencing reduced immunity. If you are eligible for a 3rd dose, please get it. Vaccines save lives, and along with public health measures, they are the best defense against COVID-19. So with that, I'll now pass it over to Ms. Mantha.
Thanks, Dr. Chirico. So in the last 7 days, we've had 18 cases, which brings our total case count of COVID-19 to 882, with 630 being in the Nipissing District and 252 in the District of Parry Sound. Our Health Unit District currently has 26 active cases, and there is currently 1 individual in the hospital due to COVID-19. As Dr. Chirico mentioned earlier, we have seen the benefits of vaccination in reducing severe outcomes associated with COVID-19. Locally, since last June 2021, less than 4% of fully immunized individuals who contracted COVID were hospitalized, and less than 1% were in the ICU. As Dr. Chirico mentioned, there continues to be an increase in the number of people testing positive for COVID-19 across Northern Ontario. Increased COVID-19 public health measures have been put in place by Public Health Sudbury districts for the Greater Sudbury area and Algoma Public Health for the City of Sault Ste. Marie. The increase in individuals testing positive is concerning. Given the heightened risk of transmission of COVID-19 at sporting events, we have recommended to local school boards that school teams not travel to Sudbury districts or Algoma until further notice, and that school teams from Sudbury districts and Algoma do not participate in tournaments within the North Bay Parry Sound District Health Unit area. Furthermore, we have recommended to local school boards against hosting or traveling to other areas experiencing high COVID-19 activity, and we will provide guidance as needed in working with the school boards to identify these areas of high activity. We will continue to evaluate the situation and adapt as required. Now it's back to you, Dr. Chirico.
Thank you very much, Ms. Mantha. I'll now turn it over to Andrew McClellan to give us an update on our vaccine rollout.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 87.1% of residents 12 years of age and older who've received at least 1 dose of a COVID-19 vaccine, and 83.5% of residents 12 years of age and older who are fully vaccinated. Currently, the age group with the lowest vaccination rates are those aged 18 to 29, with only 75% who have received a first dose and 68% who are fully immunized. That means 1 in 4 have yet to receive a dose of COVID vaccine. 81% of youth 12 to 17 years of age have received at least 1 dose of vaccine, and 75% are fully immunized. As of yesterday at 3 p.m., a total of 195,533 vaccines have been provided in our district. We anticipate that Health Canada's decision regarding the approval of 5 to 11-year-old vaccine will be released shortly. The Pfizer vaccine dose for children 5 to 11 years of age will be 1/3 of the adult or adolescent dose. Even when you believe it's the right thing to do, it can be a difficult decision to get a child immunized. We encourage parents to take the time to review information that is available about the COVID-19 vaccine to support their decision making. Several online resources are available that provide credible information regarding vaccines in children and offer advice for how to speak to your child and prepare them for their vaccination. These would include sources such as our website, the Ministry of Health's website, Sick Kids, Immunize BC, and the University of Toronto. We are planning child-focused vaccination clinics for children 5 to 11 years old that we hope will help to decrease some of the anxiety around getting a shot. More information will be available about these clinics once the province has approved the vaccine for 5 to 11-year-olds. Now back to you, Dr. Chirico.
Thank you, Ms. Collum. So that ends our remarks, and I'll be turning it over to Alex to take any questions that you might have. Please put them in the left of the screen and associate your name with them if possible, and we'll try to answer as many questions as we can.
Thank you. Our first question is for Shannon. It comes from Eric Thompson. Does the health unit know how the positive case at Au Chateau were contracted?
Great, thanks for that question. So our case investigation is still underway in relation to the cases at Au Chateau. So we're currently looking at that, and sometimes we are able to determine how cases how individuals acquired COVID or how an outbreak started, for instance, in a facility. But sometimes we're not able to determine that. So like I said, it's currently under investigation. So at this point in time, we can't shed any light on that at this point in time.
Thank you. Our next question is also for you, Shannon. It comes from Stu from Bay Today. Will all the district's school boards follow the recommendations related to the Sudbury and Sioux?
Yeah, thanks for that question, Stu. So yes, we've been working diligently with the school boards throughout the pandemic, and more recently in relation to the NASA and OFSA competitions. So definitely the school boards are in agreement with our recommendation, and in fact have communicated the recommendation to other parties, including the school boards as well as NASA and OFSA.
And I'd also like to just add that the school boards have done a tremendous job. First and foremost has been the safety and health of their students in every decision that they've made. And I really commend them for the work that they have done. And it hasn't been easy. And they're making decisions that are difficult. And we've really enjoyed working with them throughout the entire pandemic. So thank you.
Thank you. Our next question is for Andrea. It comes from Richard Coffin. With more groups now getting third boosters and more age groups expected in the coming months, is the health unit or the province expected to change the fully vaccinated language with having received 2 doses?
At this point in time, thanks for the question, Eric. That's a great question. At this point in time, we are not aware of any plans for a change in the definition of fully vaccinated outside of the 2 doses. This is considered a booster dose, not part of the primary series or that was originally defined as a 2-dose series. So we are not at this point anticipating any change to that.
Thank you. Our next question is for Shannon. It comes from Eric Thompson. With a mandatory vaccine policy in place at Au Chateau, how does that affect how the health unit is able to respond to the outbreak?
Yeah, that's a great question. So a mandatory vaccine policy is extremely helpful to us when we're doing case contact management as well as any outbreak management, especially in a congregate care facility like Au Chateau. So the way it impacts our management of the outbreak and how the outbreak unfolds is that it changes. Certain individuals may not need to isolate depending on their characteristics, so it's helpful in that circumstance, as well as we're seeing much less severity and illness. I think Dr. Chirico referenced that earlier. So in fully vaccinated cases and staff, we're seeing much less severe illness and less hospitalization. So it really does impact how we're able to respond to the outbreak, and it's extremely helpful for the facility and families in that their loved ones aren't severely ill or requiring to be hospitalized.
Thank you. Our next question is also for you, Shannon. It comes from Stu from Bay Today. It's piggybacking on Eric's original question. Has a determination been made on the origin of the Barkley House outbreak?
Yeah, no, thanks for that. So really very similar response to this question. So a determination hasn't been made. An outbreak investigation tends to go on for a little bit, even after the outbreak is declared over, as we're trying to determine perhaps index cases, which is the first case, and how COVID-19 got into the facility. If we do determine that, that's good, that's great, but at times we're unable to determine that during outbreaks. It's due to a multitude of factors, and we're not able to pinpoint one single source. So same response, really.
Thank you. Our next question is for Andrea. It comes from Brad Obing at My North Bay Now. Have residents at Au Chateau received their third dose of the COVID-19 vaccine?
Yes, I believe they have. We provided the vaccine to the nursing home, and they took the lead on immunizing the residents, and that was completed in late October, early November.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah Bissonette at the North Star. Will the health unit be putting in any restrictions above the provinces, given the increase in cases here and around us?
That's a very good question. Thank you, Sarah. We certainly are monitoring the situation really, really closely, and we haven't ruled out the possibility of having to do that. I think it's an opportunity for everyone, certainly within our district, to get vaccinated, reduce the risk so we can reduce the spread within our community so that we don't have to put in, nobody wants to put in any more restrictions, but it's going to be dependent on community spread and increasing cases and whether or not people end up in hospital. And we have some very effective tools to do that. We have the vaccinations, which can reduce, as we've keep saying over and over, reduce the severity in hospital admissions. I think that it's a colleague of mine, Dr. Liu, used the analogy of it's like winter weather driving. You know, even though you have the speed limits that can be at 100 kilometers an hour, you adjust to the weather conditions and move safely, and even decide not to go out and drive. Similarly, with this, we need to look at what risk is there by going to large gatherings. For it may be certainly legal to have that many people, but is it really worth the risk with the increasing number of cases? And everybody has to do a risk assessment and judge individually their own personal risk as well as where they're going, and is it really worth it, especially with increasing cases and going to areas that they know have a large number of cases. So we really ask people to be very careful, and if we can keep our numbers down, we've done it. Everybody should be really commended for keeping the numbers down, but if they start to increase, we may have to look at measures that might have to be put in place. Yes.
Thank you. So that completes all of our submitted questions, which will conclude our press conference. And thank you for everyone in attendance, and we will see you next week.